How is lupus remission achieved for patients? Lupus is a complex autoimmune disease that can affect many parts of the body, and its symptoms can vary widely from person to person. Some people experience periods of flare-ups with increased symptoms, while others may have times when their symptoms lessen or even disappear. Achieving remission means that a person's disease activity is reduced to a level where symptoms are minimal or absent, and organ damage is prevented or stabilized. But reaching this state requires careful management and ongoing medical care. Lupus symptoms can include fatigue, joint pain and swelling, skin rashes like the butterfly-shaped rash on the face, mouth sores, fever, and blood cell abnormalities. Because these symptoms overlap with many other conditions and can come and go, diagnosing lupus is often challenging. There is no single test that can definitively diagnose lupus. Instead, doctors relying on a combination of medical history, physical examination, and laboratory tests. The diagnostic process usually begins with a detailed review of symptoms and a physical exam. Laboratory tests are then used to support the diagnosis. The most common initial test is the anti-nuclear antibody test, which detects autoantibodies present in most people with lupus. However, a positive anti-nuclear antibody test alone does not confirm lupus because healthy people can also test positive. To improve accuracy, doctors look for more specific antibodies, such as anti-double-stranded DNA and anti-Smith antibodies, which are more closely associated with lupus. Blood tests are also used to check blood cell counts, looking for anemia, low white blood cells, or low platelets, which can be signs of lupus activity. Urinalysis is performed to detect kidney involvement, which is common in lupus. If organ damage is suspected, biopsies of the kidney or skin may be done to gather more information. Because lupus symptoms can mimic other diseases and change over time, doctors often rule out other conditions before confirming a diagnosis. Achieving remission involves a tailored treatment plan that may include medications to control inflammation and immune activity, such as antimalarials, corticosteroids, or immunosuppressants. The goal is to keep disease activity low while minimizing medication side effects. Monitoring disease activity regularly is essential. This includes follow-up visits, blood tests, and sometimes imaging studies to ensure that the disease remains under control. Patients are encouraged to work closely with their healthcare team, usually a rheumatologist, to adjust treatment as needed. It's important to remember that remission is a goal, but not always a permanent state. Many factors influence disease activity, and some patients may experience periods of flare-ups even when on treatment. Therefore, early diagnosis, consistent medical care, and open communication with healthcare providers are key to managing lupus effectively and achieving the best possible quality of life. If you experience symptoms suggestive of lupus, seeking medical advice promptly is crucial for proper evaluation and management.